Greetings, Dr. Epps, Dr. Seal, and Dr. Thompson. My name is Monet Mompoint, alongside Rachel Terry, Ashley Yates, Ryan Henry, Diari Johnson, Imari Roberts, Queen Eaton, and Janae Bragg, and we are the exceptional members of Group 15. Today, we will be presenting on immunizations and adherence amongst Blacks with children in Woodruff County, Arkansas. But before we get into our presentation, I wanted to start off with a little icebreaker question to get a better understanding of how behavior and beliefs can impact the way individuals perceive health. And as future healthcare professionals, it is imperative that we are culturally competent when advocating for health care. So how many of us have or plan to have children? Living in an ever-changing world where many diseases and complications can be prevented, controlled, or eradicated with vaccines, do you or will you get your child vaccinated based on recommendations from the CDC?
I do think that I'll get my child vaccinated because I do know somebody who died from hepatitis B, so I want to prevent that.
Okay, anybody oppose that?
I still feel a little skeptical just because of the development of multiple morbidities such as autism.
Okay, well, thank you for your feedback. We hope that our presentation serves as a learning tool for those who are unsure of whether or not to vaccinate their children.
So some of the objectives that we will be going over for our presentation include identifying the importance of vaccination adherence, analyzing the population impact, determining how serious this health issue is deemed, apply strategies within the program based upon the population and zip code, state the important concerns of parental consent with child vaccinations, enlighten the spectators on what the healthcare professionals' roles are in addressing this issue, and identify why this health care issue is so controversial within society. Our population was in Augusta, Arkansas, which was Woodruff County, zip code 72006. Our population size was 2,603 people, and our population mainly consisted of Caucasian or whites, and their number was 1,470 people of that population. The second majority group that was in our population were Blacks, and they made up 1,053 people. Also, other small groups that were incorporated into our population were American Indians, Asians, Native Hawaiians, and others, or those of two or more races. The percent of the population living in poverty in Augusta, Arkansas was 36.1%. Now, although whites made up the majority of the population living in that area, Blacks made up the majority of those living in poverty. So the percent of Blacks living in poverty was 47.5%, while the percentage of whites living in poverty was 26.3%, which was the lowest amongst all the races. The second highest group living in poverty were those of two or more races, which made up about 32% of those living in poverty.
As for the area of Augusta, Arkansas, the median household income is $22,364. The median home value is $61,300. These two values are quite low compared to other areas of the country. There are also a larger number of vacancies in this area, which could be due to a number of things such as the quality of the neighborhood or access to facilities around the neighborhood. And there's also a high percentage of people in this area that did not graduate high school. Our group is focused on immunizations and adherence to those immunizations in Augusta, Arkansas with the area code 72006. The immunization rate of children above poverty in Arkansas is 77% compared to the U.S. rate of 73.8%. The immunization rate of children below poverty in Arkansas is 57.4% compared to the U.S. rate of 62.8%. Why are immunizations important? Immunizations are important for everyone. Some people are not able to get vaccinated, and some people have weakened immune systems, such as the elderly and small children. So whenever you choose to get vaccinated, you are choosing to protect not only yourself, but those around you. And it is also much safer to get the recommended immunizations than to possibly contract an infectious disease that could potentially be life-threatening.
Is this issue? So data received from students in public and private schools within the state of Arkansas found that the exemptions for vaccines has increased by 25% in the past 5 years. Also, this number went from 6,397 in 2013 to 8,016 in 2018. The percentage of vaccinated children entering kindergarten during the 2017-2018 school year was 91.9%. This is below the CDC recommendation for vaccinated children, which was 95%. So this 95% is used to achieve herd immunity. Herd immunity is the idea that the more people who are vaccinated, the less likely we are to have outbreaks of certain diseases amongst those in the population. So, what were these reasons for the exemptions in the community? Well, it seems as though the majority of parents who chose not to vaccinate their children used the exemption for philosophical reasons, and they made up the majority of 66%, while only 2% of parents chose to file for exemption for medical reasons, and 32% filed exemptions for religious reasons. So how has this affected the community? Well, there have been many recent outbreaks in the state of Arkansas. An outbreak of mumps in 2016 allowed for 2,951 cases to be present. And as of January 10th of 2020, there were 37 mumps outbreaks found in the University of Arkansas in Fayetteville.
Important concerns of parents. Parents often consider their child's health care to be very prominent. Therefore, healthcare professionals should solicit dialogue pertaining to child vaccination. Some parents tend to be reluctant towards vaccinating their children due to numerous reasons or circumstances. So it is considered imperative that practitioners respect the parent's authoritative decision, but still facilitate education upon the matter. Practitioners are responsible for listening to concerns, acknowledging benefits and risks, answering all of the questions, and enlightening the patient on the purpose of vaccination itself. Studies have shown that healthcare practitioners play a pivotal role in augmenting vaccination rates. So below we do have a few questions that many parents frequently ask. And the first one will be, are vaccines actually safe? And the simple answer to this question is yes. Studies have shown that countries with vaccination programs usually have lower rates of vaccine-preventable diseases. Vaccine is similarly approved, just like medicine is. It must undergo an approval process that consists of, consistent testings in order to make sure that it's proved as effective and safe for the patient to use so that it won't produce any detrimental effects. The next question will be, can vaccines negatively affect a child's immune system? Parents usually fear that too many immunizations or vaccines given to a child at once will negatively alter a child's immune system. However, this isn't necessarily the case because with most vaccines, they're given in a standard schedule. And this schedule consists of splitting them up into different times that the patient will come in to get the vaccine given to them, kind of in different time increments type of thing. So due to this splitting up of the increments, the baby will be able to withstand the vaccine and based upon their antigenic exposure. And last but not least, will vaccinations cause my child to become sick? And this has became a main staple question with vaccinating children because it's always been a big stigmatism. But the answer to it is no. Vaccines do not make any type of patient sick. Vaccines basically acquaint the patient with the killed antigen in the body so that the immune system can make antibodies and become familiarized with the disease so that if the real disease ever comes in contact with the patient, their body will be able to fight it off. Now, there are a couple common side effects that come along with getting immunizations or any other shot that may happen, and it's usually fever, swelling, or soreness at the injection site. However, this is not something that you should worry about because it's naturally going to happen. It shouldn't be confused with being allergic to it or something of that nature.
Why is this health issue controversial? Immunizations are controversial because of the many misconceptions that are associated with them, such as the belief that they can cause autism in children, the belief that these diseases are eradicated so there's no need for immunization, such as polio and mumps, and the belief that these vaccines can actually cause the disease that they're claiming to cure. For example, many patients believe that the flu vaccine can give you the flu. These misconceptions cause patients to refuse immunizations, which can increase the incidence of the disease. Educating patients about these misconceptions can help eradicate them and help patients make smarter decisions based on their immunizations.
Also, key ethical debates related to vaccine regulation, development, mandates, informed consent, access disparities, and research testing. Ethical debates arise because some individuals disagree with the mandates or they have religious beliefs that conflict with immunizations.
Pharmacists play a pivotal role in healthcare and work with healthcare providers to improve public health through immunization advocacy. Studies have shown that many patients prefer to receive vaccines at local pharmacies due to accessibility and affordability to healthcare professionals. In the state of Arkansas, limitations are set for the pharmacist based on patients' age and immunization. Main responsibilities for pharmacists include enforcing the importance of vaccines to the patients and/or parents they encounter. According to the Arkansas Pharmacists Association, specific immunizations can be administered by the pharmacist if the individual is over the age of 18. Children between the ages of 7 and 17 may be able to receive specific vaccines if provided with a prescription by their physician. While visiting the pharmacy or picking up prescriptions for children, parents and caregivers can be educated on the immunization schedules based on their child's age, and recommendations can be given as needed. During patient counseling, pharmacists may be able to influence patients' attitudes by addressing immunization concerns regarding safety, efficacy, and infection risk.
Guidelines and recommendations. The Center for Disease Control states that immunizations are one of the easiest and best ways to protect yourself from harmful and potentially fatal diseases. Guidelines suggest that vaccines be given by age, starting with birth, with the first dose of hepatitis B. These vaccines are required before you can enter public grade school and sometimes daycare. These requirements can vary by state, but typically include DTaP, MMR, varicella, the inactivated polio vaccine, and hepatitis B. Here we have the vaccination schedule. As mentioned, you can see that vaccines are given by age, starting with the first dose of hepatitis B at birth. The CDC offers a program called Vaccines for Children. This program offers vaccines for free or at no cost for eligible children. The children must be Medicaid eligible, uninsured, or underinsured to be eligible. The Vaccines for Children program is for children 18 years and younger. This program is offered at the Woodruff County Health Unit at the address listed below. What is the goal here? The ultimate goal of increasing immunization adherence would be to partially or completely prevent illnesses. Immunizations provide protection against infectious disease. According to healthypeople.org, approximately 42,000 adults and 300 children in the United States die each year from vaccine-preventable diseases. Additionally, protection against illness would halt the complications of long-term morbidity with associated disease.
Strategies to combat this issue. Strategies to improve immunizations and adherence include patient reminders such as automated phone calls, emails, and text messages after every patient's visit, providing patients with direct information on vaccines, costs, and incentives to getting vaccinated, and also providing opportunities to still get vaccinated within the first week of school. Program and program goals. Our main program will be to implement a yearly back-to-school immunization seminar given by various healthcare professionals. This program will be a mandatory session given at the beginning of the academic school year in hopes that it will encourage parents to vaccinate their children. This program will involve the Augusta, Arkansas Department of Health, along with licensed pharmacists that will present at different open houses. This seminar will provide parents, faculty, and staff not only with factual information regarding the risks and benefits of getting immunized, but also ways to combat illnesses within the school system. The goal of this program would be to increase the amount of individuals being vaccinated in Augusta, Arkansas. Despite it not being mandatory to get immunized to enroll into school, we hope that providing accurate information from healthcare providers will persuade parents to vaccinate their children.
Program savings. By age 5, children should have received about 22 vaccines if they are adhering to the recommended immunization schedule provided by the CDC. Without healthcare coverage, the average cost is $124.84 per vaccine. By age 5, the program could have saved a parent around $600.
Outcomes to be achieved. The primary outcome would be to increase the number of individuals who are vaccinated within the Augusta, Arkansas area, lower morbidity and mortality rates due to preventable illnesses, provide educational information to the community regarding vaccinations, and to help build trust between healthcare providers and the community. If you have any further questions, feel free to contact us at the emails listed below.